Now, vaccines for those who are incarcerated. Prisons and jails have been hit hard by the pandemic, with major outbreaks across the country. But when it comes to allocating scarce vaccines, states have dramatically different ideas about how inmates should be prioritized. The experience of one state, Colorado, shows the role politics can play in these difficult decisions. Stephanie Sy has that story.
At age 19, Anthony Quintana Jr. was convicted of murder. Now nearly 51, he's still serving out his 40-year sentence at Lyman Correctional Complex in Colorado.
He's admitted to his part, and he's been there for 32 years. It's a long time. We're trying everything we can to get him home.
His parents, Anthony Sr. and Catherine Quintana, say their son grew up in prison and has tried to put his time there to good use.
He's taken every program imaginable in there, from computers to electric to HVAC, heat and cooling, bricklaying, plumbing.
Electric.
Yeah.
And he's a musician also.
You sound like you're really proud of your son.
We really are.
We're not proud of where he's at, but we're proud of everything that he's done.
He is still paying for his crime, but the pandemic has meted new punishments. In December, Anthony Jr., a diabetic with asthma, was among hundreds of inmates infected with COVID-19 at Lyman.
It just really scared me because, of the closeness in that facility. I really worried.
According to Department of Justice data, many inmates have chronic health conditions, and COVID-19 can be more deadly in those cases. Not only do inmates face a 45% higher COVID mortality rate than the general population, their rate of infection has been 4 times greater. Just in Colorado, nearly half the state's inmate population has been infected with the virus.
I think purely based on the science, that warrants some prioritization over the general population.
Dr. Anuj Mehta is a pulmonologist and intensive care physician in Denver. He chaired a panel convened by Colorado's governor, Democrat Jared Polis, to offer science-based recommendations on prioritizing vaccine distribution. Incarcerated individuals were included high on the list, namely because, like in nursing homes or homeless shelters, congregate living in prisons and jails makes controlling COVID outbreaks extremely difficult.
We knew that prisoners were far more likely to contract COVID. We looked at risk of death, which prisoners are more likely to die of COVID if they were to contract it. And then also the ability to socially distance, or the ability to employ kind of those core public health measures like mask wearing. And on all 3 of those levels, regardless of the congregate setting, they were unable to do that.
But when the recommendations came to light, there was backlash. An op-ed appeared in the Denver Post criticizing the governor for prioritizing prisoners over the elderly. The writer, then Arapahoe County District Attorney George Brockler, argued his 78-year-old father would have a harder time getting vaccinated than a convicted killer.
If we have one vaccine and the 2 people to choose from are a 45-year-old mass murderer or a 65-year-old innocent person, there's no question. It is the 65-year-old innocent person.
And to the backlash now over Colorado's decision to prioritize prisoners for receiving the COVID vaccine first.
Right-wing media outlets amplified the outrage.
How many people would get arrested just so that they could go into jail and get a shot?
And speaking with reporters at a coronavirus briefing late last year, Governor Polis walked back the state plan and then some.
So there's no way it's going to go to prisoners before it goes to people who haven't committed any crime. That's obvious.
He got poked in the eye and he kowtowed.
Christy Donner is head of the Colorado Criminal Justice Reform Coalition. She said the governor's pivot was political.
It's being suggested by some that this population is somehow less deserving of the vaccine.
Our perspective is that the question of deserving isn't even relevant because we're all deserving. We all deserve to survive this. And so that's why we're so committed around following the science and helping people have good information about how they can stay safe and well to the greatest extent possible.
Not just science, but social justice is at play, Donner says.
Our governor has indicated that he is very aware of the disparities and wants to have a communication and an outreach strategy specifically in Black and brown communities, in the public at large. And we keep saying to them, do you realize the contradiction there, where you're ignoring people that are in prison who are disproportionately people of color, and the fact that you're putting their families at greater risk by not vaccinating when they're in, and then they go home and they don't know if they are going to be exposing their family.
According to the Prison Policy Initiative, which tracks how states are prioritizing inmates and vaccine distribution, only 10 states specifically make the incarcerated eligible in the first phase. Most states put them in phase 2, before the general population, but after the elderly and other at-risk groups. In a statement to the NewsHour, a spokesman for Governor Polis wrote, "The governor supports the dignity and innate worth of every human life," and declared early on that incarceration status will not make a difference in terms of the timing of receipt of the vaccine. But Colorado now gives no specific prioritization to inmates, a policy which even George Brockler, the Republican who wrote that scathing editorial, says fails to take into account the risks of congregant living.
I want those inmates to be vaccinated. I'm completely comfortable with the idea that they should be vaccinated before me and the other healthy members of my family. I don't have any problems with that at all. But when it comes to discriminating between 60, 65-year-olds, immunocompromised, medically compromised, and those healthy 35-year-old prisoners, there's no question in my mind where that vaccine should go.
For criminal justice advocates, the state's current plan also ignores another issue: the impact the pandemic has on inmate operations like food service, maintenance, and laundry, functions often performed by inmates themselves. Donner's organization is now asking the governor to at least start vaccinating that critical workforce.
At least understand that in a prison context, you have essential workers, and that those essential workers should be prioritized.
Back at Lyman, Anthony Quintana Jr. is on the mend, but his parents still worry about him.
All the inmates are really scared in there. They're completely scared.
His activities and visits have been cut.
They're paying for the mistake in prison. I mean, are they supposed to be punished all their lives? You know, isn't there any room for rehabilitation?
This virus can be a death sentence to many, which it is. Now, why should they draw a death sentence for a mistake that they made?
The last visit to their son was in March of 2020, before the pandemic began. They're dreaming of the day when it's safe enough to see him again. For the PBS NewsHour, I'm Stephanie Sy.